The new coronavirus COVID-19 is spreading fast in the world, with more than 421,000 people are known to be infected. As the coronavirus pandemic slows down in China, one person has died in the country from Hanta virus, another infectious disease, local media reported on Tuesday. China in Focus NTD News said person from southwestern Yunnan province passed away after contracting the virus.
Welcome to China in Focus. I'm Tiffany Meyer. Just as the world gets prepared for the novel coronavirus or CCP virus, there is another virus causing panic. According to reports, a migrant worker in China suddenly felt unwell in the early hours of March 23rd and was rushed to the hospital. He died several hours later. According to health authorities, the man tested negative for the CCP virus but did test positive for another virus, the Hanta virus. According to the Mayo Clinic, there are two stages. The first stage includes flu-like symptoms. Then the condition usually worsens after 10 days to potentially life-threatening breathing problems. In North America, the mortality rate is over 30%. According to Chinese state-run media, the medical teams that came from other places to Hubei province to help are going home now. But according to Chinese Caixing.net, an internal document from March 20th shows the Hubei novel coronavirus epidemic prevention and control headquarters asked medical teams from outside Hubei province to stay, and the date of departure would be announced later. A source said right now, every day there are up to a dozen asymptomatic patients who test positive. The situation in Wuhan is unclear. As the pandemic continues to spread around the world, Chinese authorities announced they will lift travel bans to and from Hubei province.
In the news, it was also said that many people get tested and became positive again to the coronavirus. Here is the scope.
This as authorities have been reporting close to zero new cases for several days, but locals are worried. A citizen in Wuhan told us many people have tested positive again.
In Wuhan, many people who have been treated or quarantined in temporary hospitals have relapsed and tested positive again. Now the hospitals do not dare to accept patients. There are policies to this.
A big data analysis conducted by the University of Southampton research team in mid-February of 60,000 people who left Wuhan is lining up with how the CCP virus is actually spreading. In mid-February, the research team, known as World Pop, had tracked the mobile phone movement of around 60,000 people who left Wuhan before it was put on lockdown. The map tracked them to cities mostly in Asia, but also Europe, US, Australia, and other countries. It predicted the virus would spread further and warned countries to be prepared, and high-risk cities in China and around the world should strengthen screening to prevent the spread.
Be updated to our next news update.